Good morning, San Antonio. We are back live. Today it's Friday. It's a beautiful Friday morning. The sun is out here in San Antonio.
All in yellow because the sun is out.
Sylvia brought, so my name is Victoria Cabrera. We have
Sylvia Toscano.
The beautiful Sylvia Toscano. Nice and bright this morning.
I'm celebrating Cinco de Mayo. The day after Cinco de Mayo.
2 days after Cinco de Mayo.
And in between Cinco de Mayo and Mother's Day.
Hopefully you guys can hear us. Thank you so much for joining in. We are here. We are going to be talking about a number of different things, but we first want to tell you Happy Mother's Day for all those beautiful mothers out there, including Sylvia.
I got flowers from Victoria today. Aww. Thank you so much.
Well, now my mom's probably getting jealous right now. Don't worry, Mom.
Sorry, Mom.
You're going to see my beautiful face this weekend in Corpus. So that's all that matters.
So how was your week?
It was good. Let's see. To this week, we just worked a lot. We got stuff situated for the wedding. So we have a wedding coming up in October. So we got that out of the way. Well, some of it out of the way, not all of it. And so that's taking some stuff out of the process. So that was our week. How was yours?
It was good. Work, same old thing. Wednesday, Conviva Medical Group had a big not really grand opening, but they were supposed to open this week, and so it was postponed.
Oh yeah.
But on Wednesday they had a tour of the new clinic. It's literally across the street from the old one on Greco. Off of WW White Road.
Yeah.
And so it was a lot of fun. They had a great turnout. We did about 150 bags, and we only had 10 left.
Wow.
So, and then they got produce from River City Produce. Thank you so much. They bagged little like soup, carrots and cabbage and everything, and they bagged it for them. So everybody got to take some produce home and make some caldo.
Wow. For those of you that don't know what caldo is.
Caldo. Soup. I'm not very good with my Spanish.
You're not very good with your English either. So.
I know, so.
I'm kidding.
So either way, caldo.
Well, those of you that have just joined us, Happy Mother's Day for all you mothers out there. We appreciate everything you do. I know, Sylvia, I appreciate you so much. A friend, family at this point, and an awesome mama. I think. And happy Mother's Day to my mom out there. You're the best mom ever. I love you so much. And you've always been a big support in anything that I do, even in the bad stuff. So.
And there was a lot of bad stuff. And happy Mother's Day to my mom. She's wonderful. Hopefully she's hearing. And with my brother, he's here from San Francisco.
Awesome.
So I told him, you have to hear me.
Awesome. Well, welcome. And don't forget, guys, today's a special episode. Well, we're not going to, it's always special, but we wanted to do something nice for the mothers. So if you are listening in, please be sure to put your name in the comments. So that way we can enter you into our weekly drawing that we do. We always give our the gifts at the end of the end of the show. So if you're listening in, you're a friend, your family, and you're kind of embarrassed to put your name, put your mom's name. So that way, at least we can send her a gift, right? So if you win, we can send her the package via Amazon. We got a little smarter these past weeks, and instead of sending it through snail mail, well, it is kind of still snail mail through Amazon, but it gets there a little bit faster.
Oh, a lot faster. And their mom doesn't have to live in San Antonio.
Yeah.
So if your mom lives somewhere else, California, New York, that's okay.
Exactly.
Because it's Amazon and they're everywhere.
Exactly. So like I said, don't forget, comment your name below. Tag somebody that maybe is a mother that could be entered into our giveaway. What are we going to be giving away today?
Today, exercise equipment.
Ooh, so all you mamas that need some exercise, maybe like a yoga mat.
Exactly. The little weights, maybe that huge ball that you roll over. I don't know if that's very safe, but
yeah. Hey,
but still,
we'll
give you something
to get your blood pumping.
Yes.
All right. So what are we going to talk about today, Sylvia?
Today, I was thinking been thinking about it all week long. I've had a couple of calls this week. I had a situation. I'm at HEB on Macrelas on Tuesday from 9 to 1.
Okay.
And I had a gentleman. His name is James Simmons. I told him I was going to use his name.
Oh, you did? Okay.
Him, yes.
Okay.
Because I told him about the podcast. And so what happened was he went to go get his prescriptions that day, and he couldn't get them because his insurance.
I think that's your.
I know. I thought I turned it off.
Every time Sylvia's phone goes off, guys, I'm going to start charging her $5. What do y'all think? And then that $5, we're going to give it to you guys. How about that?
Every time my phone rings, an angel gets his wings.
Oh my goodness.
Okay. So he went to go get his prescriptions, and I told him, your insurance doesn't work. So on his way out, he stopped by. Well, come to find out that somebody moved him to another insurance.
Okay.
He was not even aware, but I was able to check on the internet on Medicare.gov, and they moved him to a different insurance. Not only did he lose his insurance, but he has an appointment on the 12th. He can't see his doctor because his doctor does not accept his plan. And he's partially blind, which makes the situation even more sad. It's just, it broke my heart.
Yeah.
And unfortunately, he went to one of the other HEBs, and one of the other agents at another location doesn't work for us, with the brokerage or anything. And it was another agent that moved him. And I was asking him, what did they tell you? He said, no. She said she was going to help me apply for Medicaid because he doesn't have Medicaid. What are you doing over there?
I was turning off my phone.
You see? An angel got its wings. So it was another agent. And so I was telling him, well, what did she say? And, long story short, she ended up switching him.
Okay.
And then during the week, so then I moved him back. And then during the week, I've had a couple of calls from my regular clients calling me, telling me they're advertising, all these other benefits on television. And I'm getting all these calls. Should I move? Can I meet with you? Is there another better insurance, or what can I do? So I was thinking of talking about that, about all these calls people are getting, stack of mail. I'm getting them now in the mail, and I'm getting calls all the time. And I know how irritating it is having to just hang up. And that's what I tell them. I have an insurance, and hang up on them. What I do is I ask them what they want in their pizza, and I pretend I'm Pizza Hut. And every time somebody calls me, they're like, "What? I don't understand."
What if it was somebody maybe you won $1 million because some raffle that you entered?
Yeah, right.
Well, that's a good point, because I know, especially Actually, there's no specific time of the year when you receive advertisements, and we don't think advertising is bad. We advertise all the time. Facebook, YouTube. In essence, this is kind of an advertisement, right? But we're trying to give education. And so there's a right way to advertise, because without advertisement, I feel that how would people actually know that there's the stuff out there?
And we call people too.
People that have opted in into us reaching out to them and things like that. So we'll reach out. But what I would say to that is that there are some people that don't necessarily do it the right way. Right? Especially these big, maybe these lead companies that are just trying to get your data, right? So let's talk about TV for a second. So that would be a good one to start with, because seniors right now are at home watching TV.
Right.
And so a lot of times, what's the first thing you see? Call us now, 0 premium, $148 back in your check, free dental, free vision, free this, free that. So free.
Free is always, it catches your attention.
Yeah.
Somebody comes in the office and, hey, you want something free? Everybody turns around.
Yeah.
Right.
Yeah.
Even if there's one person in, anything free, people are just, what are you giving away? But with free, nothing's free.
Yeah.
Really. I mean, it might be free at the time, but down the line, you're going to pay more for it.
Yes. Yeah.
And so that's the bad thing. Yes, it's free. And then a lot of times they think that these advertisements are from Medicare. So they're thinking, oh, it's Medicare telling me.
Because it says Medicare hotline or something. Yeah.
And so they're thinking Medicare is it's advertising, telling me I can get a better plan. So the first thing they think is, I want that plan.
Yeah.
And a lot of them, first of all, they don't even realize what plan they have, or they forget what benefits they have.
Now, let's provide a solution there. So for those of you that are listening now or later, if you're on Medicare, what you can do to know what plan, because a lot of times it happens, you enrolled into a plan and the agent really didn't explain themselves the right way. They left and they didn't leave their business card, or maybe they just, they left the business now and they're nowhere to be found. It happens all the time. Okay. So what happens is you first enroll into this plan and you're not aware of the plan. Right. And then what'll happen is 5 years, 3 years down the line, you're like, okay, what the heck do I have? Maybe you know your card, but maybe at some point in there, you change your plan again and you're still using the old card. So a good way, a solution to that would, if you're a Medicare beneficiary and you have the internet and you have access to get online, you can go to Medicare.gov. And there's a way to check your enrollment, whether you're in a prescription drug plan or a Medicare Advantage plan. And
super easy.
Super easy. You don't even need an email address. You just need your Medicare number, date of birth,
zip code,
name, obviously. And then when you create that account, it'll help you'll create a username and password, create something easy so that way you remember it.
Forget, take a picture of it. That's what I do all the time.
Yeah. And then in there, can they find their plan, Sylvia, in there?
Yes. It'll tell them what the plan they have right now. It will tell them all the benefits. And it will also tell them what plan they had previously for like the last, I'm thinking like 3 years. It goes back a while.
Okay.
Because I've done it to where they had, it'll show them every time they moved from one plan to another, to another, to another. It'll tell them exactly what they had.
Okay.
Or if they just have straight Medicare.
Yeah.
Or if they just have, like you said, just a drug plan.
Yep.
And so a lot of people don't realize that. A lot of people still have their whatever card they had. They might have moved them and they're not aware until they have an appointment, until they go to the grocery, to the pharmacy to get their prescription. And then there's a big awakening to go and for them to tell you, I'm sorry, but this card's no longer valid.
Yeah. Yeah.
They go to the doctor, the same thing, and they don't realize that 2-3 months ago. And that's the thing. A lot of times when I go into Medicare.gov with the clients, I look at, when I look at it, it'll show that they were moved sometimes 2-3 months prior. And I'm thinking, you didn't know? No. And they swear that they never talked to anybody, nobody called them, but they did. To move to a plan, you had to have given them authorization at some time, permission to move you.
Yeah.
And it could have been as easy as them calling you on the phone and you saying yes.
Yeah.
And next thing you know.
So let's break that process down, because I know we're getting into kind of advertisements and things like that, but let's break the process down of, let's say that you did call in because you had questions, right? And you wanted answers, and you don't have a Sylvia or a Victoria or an agency on your side to call for these things. So what you end up doing is you call that hotline, right? That get free everything. And then you end up you end up calling into the hotline, right? Somebody gets on the phone and they start asking you questions, and then they start going into the plan. As agents, there's a process, especially when it comes to Medicare Advantage and prescription drug plans. Okay. Right. So we can gather your basic information and ask you questions and try to see what's going on. But as soon as we start getting into plan specifics of a Part D, which is your drug plan, or plan specifics of a Medicare Advantage plan, there is a process that we have to do. And the number one thing is, what is that, Sylvia? Before we could
Scope of appointment.
Scope of appointment. A scope of appointment is basically permission for us to talk to you as a beneficiary about these specific products. Right. And so when you're calling in, there's a few ways to do this. If it's a call center, they're probably getting it telephonically on a recorded line. So in most cases, they'll say, Mrs. So-and-so, just to let you know, this call may be recorded for quality and training purposes, And then with your permission, we're going to go ahead and get your scope of appointment. And then they start reading down the verbiage. So as soon as they say scope of appointment or permission to talk to you about that plan, you have to understand that you guys are opening yourself up to a conversation about Medicare Advantage. Sometimes, like we help clients over the phone every day, and we normally get those via a telephonic signature, text. We send it through them in a text or an email form. And so there's always that barrier before we can talk about that. Now, if you're running into somebody that doesn't ask for your permission to do that, then that might be a red flag already.
Yeah, that little shifty right there.
Yeah, because we have to actually say, Josie, is it okay for me to talk to you about these Medicare Advantage plans? And there's a whole verbiage that we read. And in order for me to go ahead and go over these plan specifics, we have to get your permission via signature. Right. And then how would you like to get that set up? Via, would you like us to text it to you, email it to you, or would you like us to get it through the phone? A lot of these call centers are doing it right over the phone. It's super easy. But that's the first thing. As soon as they start going over plan specifics, whether it be dental, vision about a specific plan name, co-pays, then that means that you're already in that next step of the process.
Right.
And so at that point, if you're not looking to sign up for anything or change your plan, then the moment they start asking you, are you okay to submit this enrollment? It's just the application. That means you're enrolling into a plan.
Right. And sometimes I don't know if they just don't tell them, because it can be that so many clients or so many people out there who have the Medicare have been moved insurance, and they're all saying, no, I don't remember.
Yeah.
Somewhere down the line, the communication is broken. Either they're not telling them. I can't imagine all these seniors not listening and paying attention.
Yeah.
It just doesn't make any sense.
Yeah.
The only thing that I can gather is that they're not telling them the whole story.
Yeah.
And I hear it all the time. All the time. Eventually, during the course of our conversation, they'll say, oh, you know what? I did talk to somebody, or I did, make a change. I talked to somebody. But a lot of them, they'll swear. I've had situations, Victoria, where they've moved them and their daughter had power of attorney. So there was no way they could have, this senior would have given them permission. No way. They're never on the phone. They don't have a phone. They don't have authorization.
Wow.
And so you think, wait a minute. At this point, you realize, no, there's a lot of,
That's kind of scary.
It is.
Well, guys, if you're listening in right now, don't forget, put your name in the comments below, share the show. Good morning, Jessica. Good morning, Josie. Put your comments so that way we can enter you into our Mother's Day giveaway today at the end of the show. If you, like I said, if you're listening and you have a mom, just put your name and then we can send it to your mom. We're going to be giving away a yoga mat, an exercise ball, and then something else that has to do with some type of exercise. We want our moms to get the blood pumping. I mean, you and I'm going to start getting the blood pumping too. But
I started walking Will, my dog, William Anthony Toscano. It's his full
that's so
name,
cute.
But I call him Will. Anyway, so we started walking around Woodlawn.
Nice.
So I try to do it every day, but this week I did it 4 times.
See,
so that's pretty good.
There's a benefit to having a pet.
It is.
I feel like a bad mom right now. I didn't give Mila a middle name.
Oh, you have. I give them all a middle name.
But going back, guys, if you just tuned in, we're just kind of talking about how seniors get advertised to, and what happens is a lot of people call in, they make changes. They don't know what kind of changes they made. We were talking about a situation that Sylvia had with one of her soon-to-be clients, because we're actually helping them get back on the plan that they wanted to be on. But I guess he had went to HEB or something, and
they moved him there. So what happens when they do call and you do want to change? They tell you all these great things. To me, if you're at that point where you do want to move to this great insurance, they're advertising 2 things. You have to get across to the person you're talking to. Is my doctor in the network?
Yeah.
Can I still see Dr. Brown or Dr. Gonzalez? Because that's when it starts breaking. The communication breaks right then and there. Because if I'm calling somebody and this insurance sounds phenomenal, I'm gonna, and then I ask them. You have to ask them. Okay, is Dr. Brown in the network? Can I still see? They this thing about, yeah, probably, or yeah, he probably no, this probably, maybe, you need them to confirm it. You need them to look in their their website and guarantee that, yes, I can keep Dr. Brown.
Yeah.
Because at that time, if they're telling me no, okay, then where are you going to put me? Where am I going to go?
Exactly.
And how about my specialists?
Yeah.
So these are things that at that point, when they're moving them, a lot of clients, the majority, don't ask about their primary doctors or their specialists.
Yeah.
And that is one of the most important thing. Another one is prescription.
Yeah.
Prescription. Do my prescriptions, are they approved with this plan? There's some plans, Victoria, that if they have Medicare, Medicaid, all of the prescriptions are at zero cost. So then they get moved to this other plan because they're getting more dental and vision, and they're thinking, yes, but they forgot to ask about the prescription. And they go to HEB, and now they're having to pay, even though if it's a couple of dollars, $8, $9, but a lot of them are on a limited income. And to them, if they've got 7, 8 prescriptions and they're paying $8, $9
per pop,
pop, all of a sudden you're looking at $20, $30, $40, $50.
Yeah.
So we need to be credible for the decisions that we're making when we're calling people, and we need to write everything down and confirm everything. And just, doctors and prescriptions, to me, are the most important for our clients.
And it's okay. We don't want to say, because like I said before, we're a business. We advertise all the time. If you're seeing us on Facebook, if you're seeing us now, essentially these are considered advertisements. We do it more in an educational approach, but you getting to know us is an advertisement of some form. Right. So we're not saying you shouldn't weigh your options.
Yes, always.
You always should weigh your options, but there's ways that you can prevent a bad situation. And so, like Sylvia said, number one, if you're listening and you're looking to change your plan, the number 2 things that you should always do is, number one,
doctors.
Get a list of your doctors and make sure that not only your your primary care doctors in the network, make sure that your specialists are also in that network or the plan that you're changing to. The second thing that Sylvia mentioned was the prescriptions. Get a list of your medications. So everybody should have this, at least, okay? Somewhere in your files is a list of your primary care doctors and your specialists.
Right.
And a list of all your current medications with milligrams that you're taking, dosages, things like that, how often, the frequency that you're taking them. And you can get that from the pharmacy. They can print something out for you, but have that somewhere. So that way, when you're making these insurance decisions, whether it's over the phone, in person, or maybe you're even doing it online by yourself,
right?
You have that information, because if you're just choosing a plan because, oh, I like the color of the logo, and oh, I'm getting some free dental, right? Or oh, everybody's wearing those masks with this company on it. I think I want to go there because everybody else has it, right? Well, that shouldn't be the reason why you make a decision. You really need to be asking those things. So if you are calling these 800 numbers, if you are calling agents that are not us, if you are calling even us, we're going to ask you for that stuff, right? So that's the number one thing. And that's all we ask you to do is, if you are making changes, at least at the very least, and obviously benefits, right? We want to make sure that you're not paying more.
Right. Because you might... like we said at the beginning, nothing's really free.
No,
you have to pay.
Yeah.
So yes, maybe some of these benefits that you're going to get, the dental, the vision, are great and wonderful. But then on the other side, on the medical side, what are those going to be like?
Yeah.
Are you going to have to pay more for your specialists, MRIs, CAT scans, emergency, the hospital? To me, that's the most important. Hospital and MRIs and CAT scans, because those could, run you into some money.
Yeah. And so that's a good one, because we notice that with certain plans, you'll notice that in certain plans, they have a small copay,
right? But
in other plans, it's 20%. So that's a big difference. You're talking, hundreds of dollars in that case, because those are expensive. Those are expensive imaging procedures that when you do those services. But, so that, yes, the doctors and prescriptions are two of the biggest things. But like Sylvia said, you don't want to just go, okay, I'll give you a perfect example. And I won't name the carrier. Okay. But there are some carriers that give what's called a Part B give back.
Yes.
Okay.
And that sounds wonderful.
And that sounds wonderful. You're paying $148 out of your check. Guess what? I'm going to give you back $50 or $90 of that. How does that sound, right? Well, what happens is, yeah, you're going to get that money. It sounds great. Yeah, you're pretty healthy, you know, this and this and that. But then guess what? There's always a give and take, right? If you're getting something, you're more likely giving up something. Okay. So on those Part B give back plans, they're normally not as lucrative. They're not as lucrative as they would be, or not as rich in benefit, I should say, as they would on a plan that doesn't have that Part B premium assistance. Now, I'm not saying that those plans are not good, because there's a situation for everybody, especially for our people that are on VA, that are paying that Part B and that could actually benefit from that. But I'm just saying, don't get that shiny object syndrome, right? Where you're like, ooh, Part B give back. Ooh, 2000 in dental. Ooh, you know, you're getting all this, you're getting hype over all these benefits. And then you end up falling short by not asking about the doctors, medications, and what am I going to pay if I'm hospitalized? What am I going to pay when I go to the specialist? What am I going to pay? So you always have to know all your situations.
Deductible. So I was at the clinic, and one of the patients that went in there got a payback. And so she was all happy until she went to go get her prescriptions. Her deductible was very high. I don't want to say how much, because I don't want, you know, it was extremely high. It was over $300 to get the same prescription that she was getting for just 40 some odd dollars the month before. And so I had to explain to her, it's like, yes, but you know, you chose more money to get money back, but unfortunately you didn't ask him about all your prescriptions. And she didn't. She did ask him if she could keep her doctor. So, which was great. She got that, but she stopped right there and didn't ask him anything about her prescription. So now it's like, I'm going to have to pay that.
Yeah.
So you have to do all the work. You can't stop midway and assume that everything's going to be great and wonderful. That whole shiny object thing, it happens to all of us.
Yeah. Oh, yeah. It's happened to me plenty of times.
Yeah.
You know, what, doesn't matter who you are, how old or young, or it doesn't matter. Every one of us gets caught up in those situations. What's that old saying? If it's too good to be true, you know?
Probably is.
No, let's not get so, you know, we were talking about when you get advertising on television and you see free. So for those of you that are already on a Medicare plan, whether it's Medicare Supplement, Medicare Advantage, and you see something that's like, oh, I need that. Well, you know, you might want to look at your current plan. You may already have that.
Yes.
So it's always good to, there's what's called a summary of benefits that you should get when you enrolled in the plan. And if you don't have that, we can always email you, depending on the plan. If you send us your plan code, we can email you your summary of benefits if you're on a Medicare plan that we offer. And what that's going to do is going to break down all the benefits line by line, what your copay is for doctors, inpatient, hospital, outpatient, x-rays, all kinds of stuff. And then it's going to have another list of all the additional benefits they get within that plan. How many times do you run into clients, especially our own, because obviously a lot of them do forget that they have these benefits. How many of them come to you and they don't know what they have?
Oh, a lot of times. Like I said, I had at least 4 clients of mine call me this week because they got, you know, the mail and the TV. And I told them, but that's what you have right now. You have this dental and you have the vision. And they're like, oh, okay. All right. Well, I just wanted to check. They've been my clients for a long time. I try to send them a letter every year, but sometimes you don't, or they forget. Sometimes they're not getting their benefits. Evidence of coverage in January, when they're not in January, but they usually get about October, November, or they get so much stuff, they just throw it away. They think it's trash. So, or like we said, go on to Medicare.gov and look and see if you're not sure, you don't want to call anybody, go and find it. Just go in there and they'll tell you exactly what plan you had before. If it's the same year, you can compare your own plans, you know, if somebody moved you.
And let's talk about that too, because there are some people that are very healthy. They signed up for a plan. They don't really use it too much. They don't have medications. Right. They don't really go to the doctor very often. So let's just say maybe they lost their wallet and maybe their agent is nowhere to be found.
Right.
Let's say that happens and I don't know what I have. Sylvia, I can't remember for the life of me, because that happens to me all the time. I always lose my wallet, by the way. So that happens to me all the time. And I don't really use my insurance that much. So if you told me, yeah, I know I have a Blue Cross plan, but I don't know what is it like, what's involved in it, then how would they, like you said, how would they go get that? How would they find out what they have?
The Medicare.gov. If you call me and tell me, sometimes, I've had clients for, 10 years and they've gone from one to the other, and they'll call me and they'll say, Sylvia, I lost my card. And a lot of times I forget what plan I put them.
Yeah.
So I always ask them, okay, let's check Medicare.gov.
Okay.
Make sure you're still on the plan I put you. And then we'll call customer service. We always do a 3-way call and we get them the card. At that time, I give them the member ID number and the RX bin and the PCP and the group, all that.
Okay.
And just in case they have to see their doctor or they have to get prescriptions. Or you can do it yourself.
Yeah.
You can call us and we can help you and tell you what you have, compare your plans, your current plans or whatever plans. Call me at
210-878-9534. There you
go.
Ooh.
Finally, she's remembering.
I memorized.
Coming back.
I haven't had coffee either all week, so that's surprising.
So she's
I'm a little off.
A little grouchy. No, she's not. Me, on the other hand, I've had more than my share of coffee.
We're trying to make little changes. Sylvia's trying to eat less salt.
Yes.
I'm trying to drink less coffee and sugar, right? I don't really eat a lot of sugar, but for whatever reason, I need to stop. There's sugar in everything, but I just need to stop. I need to, plus I need to lose weight for my wedding. I mean, I'm not going to want to be a little chunkster in my wedding. I told my sister, because I'm going to be going to Corpus this weekend. I told her, I told the family, I was like, hey, who's ready to chunky dunk? And she's like, what the heck is chunky dunk? I said, well, like skinny dipping, but we're not skinny, so we're gonna chunky dunk.
So you're gonna get everybody on the scale this weekend. Oh, go back every month to see who's lost the weight.
Oh heck no. I'm gonna join a gym. I mean, I have a gym, but we're gonna join a different one closer to our house. And I really am gonna start getting healthier because I've not been taking care of my health lately. I've been you get a coffee in the morning with a little bagel and this, and it's just like, all of a sudden, 4 months later, you're 15, 20 pounds. It's like crazy. I look at pictures from when I was, late 20s and I thought I was fat. And I'm like, oh my God, I wish I was like skinny again. I was skinny at that time. I was like, wow, I was actually thin and I thought I was fat at that time. So if you're feeling that way,
we're all feeling that way.
Well, no, I mean, I know right now I need to lose weight. But what I'm trying to say is that, if you're in a good weight, you be grateful for it. But if you feel like you need to make some changes, definitely make some changes. Yes. We all can get a little healthier. I know. There's no such thing as being too healthy, right?
If not, I'm going to have to go get rid of all my 3 closets. I have a lot of clothes.
Yeah, if you're going to the store and having to buy bigger clothes every other 2 months, then
I refuse to buy new clothes. So I haven't gone shopping in like 3 months.
Is that why you bought this? Is that why you always come to the office like, I can't breathe? Yeah.
You are evil. It's like that's my exercise. You know where I get a lot of exercise? I always forget my mask and I have to go back to my car to go get it. So I'm like at the door at HEB or wherever I'm going, and I'm like, son of a gun, back to get my mask.
Oh,
so
gosh.
At least that's my little exercise from now. I need to start walking. So if you're out there in Woodlawn Lake and you see me, say hello. I'm with Will.
Oh, that's so cute. Well, guys, if you're listening in today, again, please put your name in the comments. We have Josie, Jessica, Stephanie, Anna. Please put your name. We're going to be giving a Mother's Day giveaway today at the end of the show. We're going to be giving away a nice yoga mat, so that way you can do your meditations, do your sit-ups, whatever you're going to do. And then we're going to be giving away an exercise ball and a little workout set. So if you're not a mom and maybe you're a guy listening, put your name in the comments and you can send me the address to your mom's house and we can send it to her directly. Or if you feel like you want an exercise set, hey, do it, right?
Yep.
So please do that for us. It really does help the channel. And hello, Andrea. So basically, guys, just make sure that you tag somebody. And thank you so much for listening in. As always, I know we always get off track.
That's fine.
It doesn't help when you have two people with ADD on the channel because we get so distracted all the time.
We could probably stay here all day and talk.
I know,
chit-chat
and
about
chit-chat.
nonsense.
I do want to point out, I know I'm getting a little sentimental here, but for those, my wifey's from Colombia, and there's a lot of crazy stuff going on right now with the government, and there's a lot of protesting and violence right now all over the country. So if you can do us a favor and just give a prayer for Colombia, go look up what's going on. It's really sad stuff.
I couldn't believe it. She was telling me this morning, and I Googled it, and it's insane. I don't want to go off on what's going on. But it's sad. It's a really sad situation of what's going on.
Yeah. So just give a prayer for the people of Colombia out there. They're going through some crazy stuff right now, and we just want to keep them in our prayers. I know that, I know it's really close to Carmen's heart because that's where she's originally from. So just say a little prayer for them over there. Hopefully things can get better, and pay attention to what's going on because it's not really on the media. So just look to see. I just want to bring awareness to that. That's why if you see my little post on the thing, it has the Colombian flag and colors. But anyway. Just wanted to point that out before I got off the show. But like I said, if you're listening in, put your name in the comments so that way we can enter your name into the drawing for our Mother's Day giveaway.
Yes.
Okay. So if you're just getting on, we were just talking about, how people call in, they see advertisements, they call in, they make changes to their plan. And we were just kind of giving them steps on things that they can do if they are going to make changes, things that they can do to prevent them from being, I do it. I run into it all the time. Where somebody's like, well, I made the change and they said it was going to be a better plan, but now I can't see my doctor anymore.
Yep.
So it's okay. A lot of people don't, well, that's not okay, but a lot of people don't know that they have to ask those questions. So if you know somebody on Medicare, or if you're on are on Medicare, or you're about to be on Medicare, remember the two most important factors are get a list of your doctors and specialists, get a list of your medications, and make sure that when you do talk to an agent, whether it's us or whether it's somebody else, that you're asking them all those things. Believe it or not, there's a lot of agents that don't ask that information. And it pisses me off that it's like, dude, how hard is it to ask people who their doctor is, verify their medications? Because let me tell you something, and this is very important. When you look at those medications, they're not all treated equal.
Right. They're not.
You might have that one medication that you think, oh, it's no big deal. I've been taking it. My group insurance plan's been covering it at only $5. Well, it's a whole different situation when you go into Medicare.
Yep. Okay.
So if your agent or you didn't give us that medication and we couldn't verify that, guess what? There's a chance that medication might not be on that specific formulary.
And you're so correct about that, because with prescriptions were approved, now that you're in the Medicare's your boss. They're the ones that approve or decline prescriptions. So never assume that it's going to be approved with the new plan, whether it's a group plan that you're coming from or another Medicare Advantage plan or just a PDP.
Exactly. So we get so passionate about this stuff because we see it every single day. Like Adriana, she's over there she'll help enroll people over the phone on Medicare stuff, on Medicare plans. And we have a whole process, a customer intake form where we're getting every single little piece of information with every person.
Right.
Because a lot of the times when they already come to us, it's because oh man, I accidentally changed my plan. Or with the guys out there, it happens all the time where they're like, oh, I just enrolled with her because she's pretty. She was real pretty. So I couldn't help it. I just wanted to enroll into a plan. You know who you are out there, because it happens all the time. And for you females out there that have run into handsome guys, that
happens. Y'all go to certain doctors because they're handsome.
Yeah. Sylvia's like, heck yeah,
they happen. But real quick on the a list of doctors and the prescription, they should have that just in case they ever go to the emergency or to the minor emergency clinics. That's something they should always have, because they're always I went to the emergency last week and they asked me what prescriptions I was on. I don't take anything, but had I been, I had just vitamins, but a lot of times seniors don't have a list of prescriptions. They just, for blood pressure, or I take for, diabetes, but they don't know the names. And so every prescription is different.
Yeah.
The milligrams, how often you take it. So, not just for the insurance, but just for your well-being, just in case there's ever an emergency and you have to go to the doctor, you can tell them, this is what I take. Like that, if they prescribe something, you won't have a reaction with what you have.
It might be a good idea for, like you said, have that copy, but also make multiple copies and maybe give one to your kids or whoever helps you take care of stuff. I have a lot of seniors that have like roommates or they've had a best friend from the senior center. So maybe, you want to share that information with them. So that way, if something does happen, it really does come in handy to know in an emergency situation, if something like that does happen, you can kind of be that extra guide for them.
Right.
And so that's a good point. I mean, getting that information. I mean, we should be taking our own advice. Luckily, I don't take medications and I don't really have doctors that I have to see right now, luckily. But for those of you that do take some medications, it would be good to have that list somewhere.
Right.
And like I said, thank you so much, guys, for listening to the show. It really does help our show get to more people. If you're listening in and you haven't put your name in the comments, be sure to put your name in the comments. We're entering you in to a Mother's Day drawing. We're doing a yoga mat and a little workout like equipment type deal. Where if you don't want it, if you're a guy and you don't think you can use that stuff, just put a comment with your name, hi, hello, whatever. And then we'll send that to your mom. Because we do everything through Amazon now. Right. So we're just going to, we'll send us the address and we'll send it right to them. So thank you so much for listening, and be sure to put your comments, whether you're on YouTube, Facebook, the Facebook page, or our personal page, put your comments down below. Thank you so much for listening. So like we were saying before with these advertisements, they don't just get them on the TV, they get them in mail, right?
Right. I personally send out information.
And
a lot of times I'll get the information goes out to them. And then if they want more information about Medicare, they put their name and number and they mail it back to me. And so at that point, when I call them, I always remind them, or if I text them, I send them a picture of the letter that they sent me, because a lot of times you forget. I forget sometimes. I ordered some beautiful pillowcases like 2 months ago. And the other day I got home and
we'll ruin them.
No, there was a package outside and I'm thinking, what did my daughter order? Because she orders. And I opened them up and there were my pillowcases that I forgot. I think it was probably like 2-3 months. Completely forgot it. I'm like, oh my God, I finally got them. And so if I forget, I'm sure everybody forgets.
Well, we know why you forget, okay? Okay, we know why you forget.
If I forget my pillowcases, then I'm sure a lot of these seniors, they're getting my information and they write their name and they're writing their address. And if they're married, if they have Medicare, they're sending it back. So when I'm calling them and I'm telling them, they're like, no, I didn't call. So what I do is I text them the piece of paper and then they'll call me back and they'll say, oh yes, that's right, I did. Because, it might be 2-3 weeks and they forgot they're doing that. So if you do return something back, remember that they're probably going to call you, or we are going to call you.
Yeah.
Yeah. Now, if you just get
So you're talking about send them a piece of mail.
Yes, I send them a piece of mail.
And then they filled out the little postcard requesting more information. And then they send it back to you.
Either about Medicare or Medicaid. Or how to get more extra help with prescriptions or help paying their premium. So I send out all these little
mailers,
advertisement. Yes.
So guys, just to let you know, advertising is not bad. Okay. We do it all the time. The reason why is that people, even you, think about you, like, it's so crazy. For the last year when we installed the pool, we've been trying to install a heating line, like the heating line, and it requires a plumber, right?
Have you done it?
No.
Victoria? Not only that, my brother told me to tell you that all the supplies for the pool.
Can you mention that right now? Well, yes, the chlorine and stuff like that.
The chlorine, the tablets, he said they're going through the roof.
Okay, so
if
you have a pool, and this is off Medicare, so we're providing you some value here when it comes to off Medicare. If you have a pool, chlorine supplies, a lot of that stuff is going up the roof because there's supposedly a shortage in pool supplies. Not only that, tell them what you were telling me this morning about the electrical.
So my brother's an electrician. He owns Mesa Electric. On Culebra, I'm all advertising for him. Anyway, so he was telling me about how all the electrical wires going up from a roll of the wire of $80 up to $180.
Aye.
So he had given out bids a couple of months ago, and now he literally has to double the amount because of the material, as to where before the material was low and the labor was higher. Now it's the reverse. The material is so much higher.
Yeah.
And they can't keep it up. A lot of the big, Home Depot, Lowe's, they're getting the pallets and they can't keep them because everybody now is like, let's buy them before it goes up again. So things are everything is going up. It's kind of scary when it comes to the prices, the prices of how much they're going up. And so just heads up, a lot of things are going, even gas.
Yeah. So we just want to point that out to maybe preventive care, like not just on your health, but on your home. If you own a home, make sure that, you're just doing things that prevent that, because it is electrical is already expensive.
Right.
But, just make sure that you're doing your due diligence and making sure that, it's good stuff, because I didn't even realize that. But going back to see again, our ADD,
we go around the corner. We're back.
Steffi says, my grandma carries a Ziploc bag with a list inside of everything she takes, everything she is allergic to, along with all the surgery she has had. It has come in handy more times than you think. That's a great idea. That's a great idea. So guys, one of our listeners was saying that her grandmother has a Ziploc bag with all that important stuff. Maybe not your social, so don't put that in there. But like she said, she puts things that she's allergic to, surgery she has had. That's important. You'll be surprised. Stuff happens, right? And you just don't know when it's going to happen. And it's always better to be prepared.
Yeah,
be prepared. So that could actually save your life in a lot of cases, right?
Yeah.
So like I said, guys, thank you so much for listening in. We're not leaving you. Actually, I'm going to start writing names down because we're coming up to 15 minutes at the hour. So if you have not put your name in the comments, I'm going to start doing this raffle here in just a second. So you still have time to put your name in the comments. So far, we have Stephanie, Andrea, Anna, Josie, Jessica. All of you have been entered into the Mother's Day drawing. Again, if you're listening, you still have time. Put your name. Don't be shy. All it takes is you to go deet, deet, deet on your phone. Say hi.
Do that again.
Deet, deet, deet.
Okay. Before we forget, next week you're not going to be here because you're going to.
I'm going to be in Vegas
baby.
Not for fun, but more for work. But all work is always fun for me. So, but I'll be in Vegas from Wednesday through Saturday next week. So unfortunately, we're going to have to do the show Tuesday afternoon. Tuesday afternoon.
I have an appointment Tuesday.
Aye.
Let me double check.
So if we can't do Tuesday afternoon, then maybe
because you're leaving Wednesday.
I'm leaving Wednesday. Okay. So maybe Tuesday afternoon, because I know you said you were at the HEB until 1:00. So we had said Tuesday.
I have an appointment at 2.
So maybe we can't do Tuesday. So
what if we do it? Let's do it at 2, and then I'll call her and move her an hour later.
Okay. So we're going to do it at Tuesday at 2:00. We don't want to not do the show again because we didn't do the show last week, and we like to get stuff out there. So Tuesday at 2:00, join us on the show live. We're going to be live because I'll be out of town, unfortunately. I usually go out of town once a month. So if we do have to move the show, we will definitely let you guys know in advance. Priscilla, welcome. So let me go ahead and write these names down. And what I'm going to do right now. So we're going to be giving, what are we giving away again, Sylvia?
Exercise.
Wah, wah. Here. Nobody wants to exercise.
I know. I used to exercise all the time when I was young.
So last week we gave away a folding chair and a lunch box.
Yes, that's right.
To this week, and the week before we gave away some gift cards that seemed to be very popular. And the week before we gave out an electronic toothbrush that we still got to get to Anna.
I know, it's still here. Every time I come in, I sit there.
It's still sitting there.
One more week, it's going home with me.
And then we also gave away, what else did we give away that day?
A little barbecue pit?
No, it was a barbecue accessory set.
Okay.
Barbecue accessory set. So I'm going to go ahead and put your guys' names in the drawing. Let's see.
Please.
Huh?
Right. Where I can read it.
Oh, well, that my handwriting's already chicken scratch handwriting as it is. So for those of you that listen in today, we were just discussing when advertising, when seniors get advertisements in the mail, or when you get advertisement, it doesn't have to just apply to seniors, guys. You know, a lot of you guys that are listening are probably homeowners, and you get like these mortgage protection, protect your mortgage, car warranties. You know, if you're going to be calling, just make sure, you know, you're just
your job diligently when it comes to, because I always get all these, you know, for insurance, for my house, for my car, or credit cards, and they all sound great. I always get these checks. How many people have seen those checks where they'll send you $10,000 check, $15 check, and I always look at the back because I always like to see what their interest rate is. It's one of them was 29%. It's like, you know, but people don't read because it's so tiny. I could barely read it without my glasses. So do your job diligently. Make sure that if you're looking at an advertisement, if somebody's calling you, that maybe there is a plan that's better than you. Like I tell my clients, I'm selling you this plan. We've decided on this because of your doctor. And if down the line you hear that there's a better plan, call me and I'll sit down and I'll explain to you. But don't assume that they're better because they're giving you more benefits, because you might lose something on the other side. So, you know, make sure that you're getting what the whole enchilada.
Yep. Oh, now you're making me hungry.
Not just the rice and the bean part.
I'll take the rice and the beans too.
You're getting the whole enchilada. And another thing, make sure that you give your kids I always give my clients a card for them and 2 or 3 extra cards for their kids.
Yeah.
Because in case something ever happens, sometimes they don't even know what insurance their parents have.
Yeah.
And so I've had kids call me telling me my mom's in the hospital. What do I do?
Yeah.
And so I'll call the insurance and, you know, get their information.
Yeah.
So because when an emergency arises, you leave the house sometimes without your purse. Ambulance comes, takes you away, and you know, you don't have a purse, you don't have any information on anything. So whoever's there, your kids, your partner, your neighbor, have somebody there,
somebody you trust. You know, somebody you trust. Okay, I'm gonna close up these names. Okay. Actually, I accidentally wrote Steph's name down twice, so I'm gonna put this over here. So we're gonna be giving away a yoga mat and an exercise ball, like those bouncy balls, right? And then probably something else.
Yeah, little weights, maybe for your ankles, or you know.
So I think I have everybody in. If you're listening and you have not put your name in, you still have time right now. 5, 4, 3, 2, 1.
Did you have noise? There you go.
Okay. Okay, so I'm going to be doing, let's give away.
Like a genie.
I'm going to do it again.
Do it again.
Oh, gosh. All right, guys. And if you need help with Medicare, as always, you can reach out to us. Sylvia's, what you want to give him your number again, Sylvia?
210-878-9534.
And that is her cell phone number directly. You can reach out to her and she'll help you with anything. She's very good. I mean, she goes above and beyond,
Not bragging.
Above and beyond what you would expect for an agent to do. So,
and not it's my job. Yes. That's what I do. I sell insurance. But I always remember my grandparents paying their co-pays, and they had their medical bills. And, I was young back then. And so I don't know what insurance they had. I don't know. I know they had probably Medicare. And I hope that somebody at that time, back in the 50s or 60s, somebody took care of them.
Yeah.
So I always see people as my grandparents. I want to do what I hope somebody would have done for my grandparents. And if they didn't, if my grandparents fell through the cracks, I'm not going to let that happen to my clients.
All right. The first one is going to be the yoga mat. Who's going to win the yoga? Hey, and if you win the yoga mat, I want you guys to take a picture on your yoga mat.
Before and after.
Oh, and then post it on our page and be like, I've done meditation with the Medicare Space. So Anna, okay, perfect. Anna, okay, now you got two things to pick up, okay? You got a yoga mat and a toothbrush, okay?
You have to. Well, we can send that to her.
Oh yeah, that one we can send that to her. The toothbrush, it's kind of hard. Or maybe we'll just buy her one and then just keep that one here. Okay, so we're doing that. We're doing the
little ball,
the little ball here. So see, as you can see, we have the names. Okay, who's it gonna be? Who's it gonna be? And if you are a restaurant, Andrea, she can use a ball. Andrea, you just won a nice exercise ball. All right, who's next? What are we doing? Or is that it?
Let's do one more.
Okay, Sylvia's feeling gracious today. All right, what are we giving away? How about this is going to be a little surprise, all right? This is a mystery gift. Here. So, and okay, so we got Andrea that won the exercise ball, and we got Anna that won the Steph. She's you can give her the mystery prize.
I'm not gonna ask her what she was, because if not, it'll be way too much.
All right, guys. Well, what we're going to try to do next week is maybe try to have somebody on.
Yes.
That can actually, because 2:00 is a little easier for some of our community partners to get on a call. So we're going to see who can come in last minute, get on a call at 2:00 next week. So if you can do us a favor, tune in next Tuesday, 2:00. Unfortunately, next Friday, I'm going to be out of town again. I know
Vegas, baby.
Give me 29. So if you're listening in next Tuesday, 2:00, we'll post it on the page and remind you on Monday that we're having the show on Tuesday at 2:00. If you guys don't have any other questions, thank you so much for joining in. As always, we love you guys.
We love you guys.
And happy Mother's Day again to all you beautiful mothers out there. I will be seeing all my sisters and family in Corpus this weekend, so that should be fun. And what are you going to do this weekend?
Maybe a little drinking. See my mom eat. My daughter still doesn't want to go out. She had her spleen removed, as you know, about 2 years ago. So she doesn't go anywhere other than H-E-B or Walmart. And so we're going to order in.
Okay,
cool. Not sure where we're going to order in, but we're going to be probably at my house or my mom. My brother is here from San Francisco. Junior, hello, Junior.
Nice.
And
hello, Junior.
I do want to say hello to my granddaughter, Emily Toscano. If somebody knows where she is, what she's doing, tell her grandma loves her.
Nice. Well, that's so sweet. And again, guys, thank you so much for joining in, and happy Mother's Day. We'll see you on Tuesday. Okay. Tuesday.